ITIC for organizing this, Zoom conference. It was very, very useful for me to listen. And then the best part of it is I get to see my friends that I have not seen since January. If it were normal circumstance, we would have seen almost once or every month or once every other month. But anyway, having said this, yes, Korea has managed this COVID-19 situation quite well, but we didn't plan it that way. And one of the, when we didn't have firm control of the border between China and Korea, and Korea was in panic. We didn't know where to go. We didn't know what was coming to us. But at the end of the day, when we look back, it was a right decision by government not to completely close the border between China and Korea. Then how well could we, what made us do well so far? I think it's Koreans' DNA that whenever we see crisis coming, we go government, public sector comes to partners, in true partners. And we are willing to sacrifice our personal liberty, personal movement, if it serves for the good of the public. For instance, the reason we were because we were able to test, we needed to test, and testing was not a big technology for us because we had been very well prepared. We had documents from how we dealt with the MERS situation 2015 and SARS. And then we had this, once the test was done in such quickest time, that if there's someone who has been tested, affected, but didn't follow the rule of containment, we are able to trace them. And I think some of the Western media accused Korean governments doing this, that infringing upon privacy of individual. But for Koreans, it was not so. We didn't, private citizens, freedom did not, when it was going toward public good. And so this, and then to do this, of course, what you have mentioned, technology, our advanced technology, mobile phone, internet, all this helped us getting, so we had a thorough tracing. We just traced anyone who was not following the directive. And then I think the last part is we had a very fine medical system for cure for those who are affected by the coronavirus. We were able to take care of them. So having said this, if I may say, in tourism before, when we choose tourism destination, we went for shopping, we went for and the scenery and all this, we went art and everything. But now we are seeing healthcare system. In fact, it's not just security. Peter Tarlow, he's been very famous giving a security segment aspect of tourism. But now I'm saying is medical safety of tourism is very important. I'm going to get into this situation, then where am I going to get proper treatment? You're far away from home, you're just total stranger. So we will look at medical system, and I think that's where Korea won this time, that we do have a medical system, treatment system, that a traveler or Koreans get into this sickness, that we are able to, we have that infra laid down. So with this, I just, enlarge what you have asked me.
Well, Ambassador, I mean, perhaps you can paint me a picture then of the future experience of a tourist to South Korea. I mean, talking for instance about health, I mean, when you have, for example, a doctor in every hotel, every large hotel, or people knowing how to get hold of medical assistance as soon as they need it. And when it comes to digitalization, is everything going to be contactless in South Korea in the future? Explain to me.
I'm glad you asked me that question. Yes, we have almost perfect system for that matter. Every hotel, even if it's a small inn, family-run inn, yes, we have a system called Call 119. And that ambulance comes with equipped with the medical personality, and they take us to hospital right away. Of course, we do have some language problem because Koreans do not speak English, but even that, we have the system called use translating system. So, and then we get that. So the communication problem in getting medical, medical hospital is all done, and we tell those travelers, yes, if you have any problem, you call 119. And then you have, at the minute you have this call coming